Good afternoon, everyone. My name is Lauren Levine. I'm a partner at Garfunkel in the litigation and employment groups. Thank you for joining me for this 30-minute session on navigating human resources in the healthcare setting. As we all know, shortage of healthcare employees, burnout, and patient dissatisfaction are challenges that have been facing the healthcare industry for some time, and they seem even more pronounced since the pandemic. It's important as a healthcare entity to balance your business needs to maintain staffing levels and address those issues with addressing HR related issues. It may seem simple, and some of the things I'm going to talk about may seem obvious, but we find that many times clients and healthcare organizations skip one or more of these steps, and that's when we see employee complaints, administrative actions, and potential litigations. It's really important to have a clearly identified HR plan or process in place consistent with what I'm going to talk about today. Not every HR issue is covered in here, but these are the main issues that we often see and we often get called about. If you have HR at your office or you have an HR consultant, you always want to make sure you include them early on in dealing with any of these issues. And if not, of course, if there's any issues that need to be addressed, you can always seek guidance from your counsel. So the first part of your HR process is going to be your hiring and your retaining staff. And with hiring, of course, from the beginning, you want to strive to find the right candidate and you're going to screen your resumes. But one thing I want to mention that we get a lot of questions about is the Fair Chance Act type rules. After you offer a conditional offer of employment, when you're running background checks on employees, you need to be cognizant of the relevant background check laws. There are certain professions that require background checks, and there's certain licenses that require background checks. And many of the employees you hire, you'll need to be prepared to conduct this analysis when you're running those checks. For instance, in New York, the Fair Chance Act requires that when a background check shows up with a past criminal conviction, that you're only able to consider those criminal convictions under certain circumstances. And that's when there's a direct relationship between one or more previous criminal offenses or convictions and the specific employment being sought. And that's true for any past offenses that show up, whether it's a conviction or whether it's an arrest. They must be related to what the individual is seeking to do for your entity. And the issuance of a continuing employment or employment would pose an unreasonable risk to the property or safety or welfare of any specific individuals. There are several factors that you need to consider when a past criminal conviction or arrest or some other relevant information shows up on a background check. And in New York, for instance, if you're not going to hire someone because of these reasons, they're entitled, if they request, they're entitled to a written explanation. So you really want to make sure that you do the analysis appropriately, that you're aware of the factors, and that if you need assistance with doing one of these analyses, that you reach out. This is true for current employees. Sometimes we have clients who decide to do background checks when they hadn't been doing them for whatever reason. Maybe they're growing or whatever reason they didn't do them. These rules apply also to currently existing employees. Or for instance, if a currently existing employee is arrested. The next thing I want to talk about is offer letters and job descriptions. Again, all too often we see that organizations have maybe an offer letter but not a job description, or don't have either, or don't have the type of information in them that should be there. These documents set expectations, and they also become relevant later for not only for performance evaluations, but other issues such as when an employee asks for an accommodation. One thing I want to point out is you want to make sure to include ADA compliant language regarding physical and mental demands of the job. And one example, especially in the healthcare field, is if you have someone who's going to need to be moving or lifting patients, you want to have that physical demand in the job description. And what you would do is you would say needs to be able to lift or move, and you give a certain amount of weight that would be relevant for that particular position. So that is recommended for your job descriptions. Employee retention, as everyone knows, it's important to cultivate an organizational culture You could do that through programs such as diversity training, events for your employees, team building. And one thing I highly recommend is having an open door policy. We're going to talk later about your handbooks. I always recommend an open door policy. Not only does it cultivate a more comfortable culture where employees feel comfortable coming to you, you'll also notice earlier on if there's frictions that are existing if you have an open door policy. The next thing that you want to have in your HR program is training. Training is not only important in terms of substantive training, but there's legally mandated training and other training that will help you in the event that you wind up in a situation where there's a complaint or a lawsuit. Failure to train your staff can put you at risk for lawsuits, fines, and worse, potential criminal charges. Too often we see there's statistics that in the healthcare field in particular, comprehensive training is offered to certain staff, but for instance, there's statistics showing that for diversity and inclusion training, that managers are not always required to attend. You should be providing those types of trainings to all your employees and everyone on your workforce. For some legally required training, or such as anti-harassment or anti-discrimination training, which is required legally in some states and always recommended no matter where you are, you want everyone who's on your workforce to be doing those trainings. And one thing that I see a lot of times is, for instance, where you have an organization where the physicians are not employed, and they are, they have privileges to work at your facility, but they're not employed. I'm seeing oftentimes that they're not receiving, for instance, the anti-harassment or anti-discrimination training that's required. And you're responsible as the entity for everyone's behavior who works on your premises or who steps foot on your premises, quite frankly. So you want to make sure that those physicians are getting that training as well. And we also see sometimes that physicians or other employees who have more than one job or work at more than one facility receive the training elsewhere. That's okay too. For instance, in New York, where the training is required annually, as long as the employee gives you a certificate from the other employer, that's enough to comply with your requirements, and that's enough for the kind of proof we would want if you wind up in a dispute over this. Make sure you have written or electronic proof of completed training for all your employees. So when I'm talking about someone who did training elsewhere and they need to provide you proof, you also want to have proof that someone did the training at your organization. The next sort of step or tool in your arsenal for common HR issues is your handbook, your manual, your policies. You want to really make sure that you have those in place. It not only tells the employees what's expected of them, it also, if you have these policies and you apply them consistently, it brings about fair and equitable treatment and will help you to avoid potential complaints based on, differing treatment and not having policies in place. It also lets employees know what the consequences are for their failure to comply, and we'll talk a little bit about that in a few minutes. Legally required policies can be housed in one easily accessible document. I recommend, if you can, have a portal for your handbook and all your policies. Your handbook is also a very important defense litigation tool. For instance, the first thing that we often see when we get into a litigation that we're defending is the plaintiff's attorney will ask for your anti-retaliation and anti-harassment policies, because if you don't have them, that's a factor that's considered in punitive damages. So you want to make sure you have all of those in place. Or for instance, if your employee says, I didn't know the rules, or I didn't know how to make a complaint, those things all should be in your handbook so that later on, if you do wind up in a dispute, you have those, at your fingertips. You also want to make sure you have signed written acknowledgement from all employees that they've received these policies, so that it becomes an issue. You have the proof that they saw and signed that they understood and read the policies. More than once, unfortunately, we've had a situation where the employee who didn't sign just coincidentally happens to be the employee who is the subject of a harassment complaint. So you want to make sure you have that in place. You want to make sure you have all your required legal notices as well. And obviously, we all know there's posters. You can go through your payroll, or other companies do the legally required posters. But there's a couple that are really important, and one that's become sort of a hot topic over the last year is electronic monitoring notice requirements. Both New York and Connecticut have laws that govern the surveillance of employee internet usage, communications, phone calls, texts, and emails. And you need to have that notice in written or electronic form, advising employees that all of their conversations or email communications or internet access may be subject to monitoring, and that's within lawful means, right? There may be certain exceptions, but generally, we've seen a big uptick in electronic monitoring and being able to access the employees' emails or whatever else they do on your electronic system. You want to make sure you have those notices and that information in your handbook. This is all true regardless of the size of your business. Sometimes we get people who say, well, I'm a small practice, I don't need this. You do need these handbooks and these rules. They're legally required policies, and some of them are legally required to be in your handbook if you have a handbook. So we do recommend this no matter the size of your business. The next step in your arsenal or in your program for navigating HR issues is your written performance evaluations. These can be used as a shield or a sword if you wind up, in a dispute later on, and I'll talk a little bit about that. But they also provide general expectations. They help give feedback to your employees. That helps cultivate that organizational culture I was talking about. It gives employees, goals to work towards as they continue. It allows them to review, last year's goals and see if they've met these goals. It sets expectations and behavioral standards. And just like, in every section, I'm going to tell you, you want to get your employee acknowledgement of receipt of these things that you're giving them. It's not necessarily their agreement to the content of the evaluation, but you do want to always make sure that you get their acknowledgement. If someone refuses to sign a performance evaluation, you want to make sure that you document that and that you have a witness so that you have the date and the time and who's recording that the employee refused to sign. When you're doing evaluations, you do want to make sure that you focus on objective criteria. And this is going to tie back to that job description, that offer letter and that job description that tell the employee what their job was. Those same parameters and essential functions are going to be reviewed later in these evaluations. You want to motivate improvement in productivity. You want to give constructive criticism, but you also want to give positive reinforcement, and the review is the perfect opportunity to do that. In your reviews, you want to be truthful, stick to the facts, avoid any inflammatory words or statements. Don't say things like always or never. Don't compare them to another employee. You want to just stick to the facts of what they are doing and how they can improve and where they're doing well. When using a rating scale, you want to give explanations. You don't want to just rubber stamp. You want to give specific explanations when you give them a number. We may have a rating scale from 1 to 5. We've seen all too often, we have a client call and say, I want to terminate someone. They've been a terrible employee, their performance, their behavior has been terrible. And the first thing we do is ask for the performance evaluations. And unfortunately, many times we open them up and either they're not in the file, or the employee was given all 5s. And especially in the healthcare context, we've unfortunately seen situations where that's led to significant danger and safety issues, such as we had a situation, there was an anesthesiologist who was getting all perfect reviews, and it turned out he had been responsible for 2 patient safety events. So you want to make sure you're really not just rubber stamping and you're giving real evaluations. You want to perform them at regular intervals. I know it's hard. Everyone's busy. We have a lot of challenges, especially in the healthcare industry, but you want to give those reviews, whether it's every year, every 6 months. You want to stick to an interval, pick it and stick to it, and make sure you're getting those reviews done at the right time. You want to provide your employee an opportunity to comment. When you ask them to sign, you also want to give them an opportunity to comment and have an open discussion about areas for improvement and what they have been doing well. Performance evaluation supports disciplinary measures such as termination, and that's why when I mention not just rubber stamping and making sure that you have actual meaningful evaluations, it's important to have those for that reason. The next thing you want to have is you want to have a process in place for investigation when you do get an employee complaint and when you do need to discipline an employee. One sort of overarching thing I just want to talk about briefly is confidentiality. Don't ensure an employee that you're going to keep a complaint confidential. What do I mean by that? Obviously, we're not going to say to an employee, we don't keep complaints confidential. But my point is, you can only keep complaints confidential to the extent practical, right? You're going to need to interview other employees. You may need to disclose certain complaints because you're legally required to do so. So you can't promise, the utmost confidentiality that you won't disclose to anybody. You also can't promise confidentiality if someone says to you, I have this issue, but I don't want to make a complaint, right? If you get, for instance, a complaint of harassment, and if an employee says, I don't want you to tell anybody, but I just want to tell you about that, you can't promise that confidentiality. You have a legal obligation to investigate, and you need to make that clear to your employees. We've had situations where employees make those complaints and then say, but I don't want to give any more detail and I don't want to be involved. What I recommend there is that you follow up, you tell them about your anti-retaliation policies, and you tell them that you can't properly investigate unless you get their cooperation or the information that they have. So that's obviously very important. The other reason not to ensure confidentiality when asked to speak off the record is you may be being recorded. You should always assume, I can't tell you how many times we get clients when we get involved in whether it's an administrative proceeding or litigation, and employees are recording. Always assume they might be recording you. On the flip side, though, we also get clients who want to record employees. There's privacy laws involved. There's the electronic monitoring I was talking about. So there's legal considerations that you have to think about before deciding whether to tape a meeting or a conversation. Not saying that you never should, but it's really a fact-by-fact analysis or a case-by-case analysis. You want to make sure you talk to your HR consultant or your HR person or your counsel before deciding whether to record something. The other reason, sometimes I caution people against recording, in addition to all of those legal considerations you need to look at, is you can't control what someone might say on a recording. And unfortunately, we have had clients who've recorded and the recordings are helpful to the employee. You can't control what somebody else might say on a recording. So that's something to consider when you're deciding whether or not to record an investigation related meeting. Another big one is to make sure the individuals involved are told not to discuss or disclose information to coworkers. The only way to keep an investigation as confidential as possible is to obviously make sure that people are not talking about it. Obviously, anybody who has a complaint, you can't tell them they can't talk about workplace conditions, but I'm talking in the context of the investigation. We've had some situations where the fallout from people talking about a situation was actually worse than the original complaint. I had a situation where there was a sexual harassment complaint. There was an inappropriate comment made by a supervisor. It had been addressed, but the fallout was worse when all of the coworkers started talking about it. And then we were faced with, the client was faced with an alleged retaliation claim. So you do want to be really careful to make sure that everyone's aware of the sensitivity and the confidentiality of your employee investigations. I don't have to tell everybody, but it does it's worth repeating that, in the context of healthcare, permitting disruptive behavior really can adversely impact the quality of services provided. And for years, the Joint Commission has recognized that disruptive behavior undermines a culture of safety. Now I think they use the word unprofessional behavior, even if it broadens that a little. I've had clients who say to me, oh, well, so-and-so just yelled, that's their managing style. It's not discriminatory. We don't need to do anything about it. That's not true. You can't allow unprofessional and disruptive behavior, to continue. Not only does it lead, to potential poor outcomes and, turnover and low morale, but it also can serve as the basis for discrimination or harassment or other complaint, especially where, the person who's being yelled at falls into a protected category. If there's anything you take away from our 30 minutes together, the most important thing is documentation is crucial. You always want to document. It helps you do your investigation when you are investigating a complaint. And when you do those investigations, you're going to want to interview everyone involved. It's important to decide what your goals are of an investigation, who will conduct it, and then you want to document along the way, right? You're going to do your interviews, the who, what, when, where, why. You're going to document those interviews. You're going to do fact finding. You're going to gather materials, and you're going to draw conclusions. And that's all going to need to be documented. And just one word of caution, don't jump to conclusions when you're doing employee investigations. You want to really thoroughly analyze and not agree with anybody about what they're saying during an interview. You want to be a sort of a neutral fact finder. And if you can't do that, if you have an HR person, your HR consultant, or of course your counsel can be involved in those investigations. And again, you want to implement any discipline that's necessary to address, especially like I said, in the healthcare context, these adverse behaviors that can lead to so many negative outcomes. With respect to the documentation, again, this brings about fair and equitable treatment, just like your handbook, right? Your documentation is going to let employees know what you expect of them. And I'm not just talking about disciplinary warnings. I'm talking about, you may even have the situation, maybe it's a minor infraction. Somebody's late 3 times. You can put it in an email. It doesn't have to be a formal written document the first time you address a situation for minor infractions. Send an email saying, you've been late 3 times now. If you're late again, I'm going to have to write you up. Or you forgot to clock in 3 times. If you do it again, we're going to have to write you up. So it's as simple as even just putting documentation into an email. If you plan on disciplining or terminating someone, make sure you put that in writing early on. We've had situations where a client maybe intends to terminate someone, but that employee makes a complaint first, and then you're in a bind because you're going to be accused of alleged retaliation. We had one situation where on a Friday night, a client decided to terminate someone. They documented. That person asked for FMLA leave on Saturday, but they had that documentation in place already. If they didn't, obviously, that would have been difficult. And timing alone may not win a discrimination case, but certainly the timing alone, it gives enough, speculation that maybe the timing was related. So you want to make sure you act promptly and put everything into writing when you're going to make an employment decision. Implementing progressive discipline. Again, you want to investigate, you want to document in writing, and you want to document contemporaneously. I've had, unfortunately, more than one case, and one in particular that was very significant, where we were told that the employee had been disciplined throughout their employment. It turned out that those documents had all been drafted on the same day at the time that the employee was being terminated. Needless to say, that client needed to resolve that matter. So you want to make sure when you take these steps, all of the dates and times and everything should be documented contemporaneously. You want to be consistent and fair. When you decide on level of discipline, look at what you've done before. Talk to your HR people about what level of discipline is warranted. There may be situations where, the discipline is going to be so significant that maybe you think twice about whether you should even keep the employee. And what I mean by that, for instance, is, I had a case recently, a client said, I want to suspend someone for 2 weeks. If you want to suspend someone for 2 weeks, then you want to think about whether or not really that person should really be terminated if the behavior rose to that level. So you want to be fair. You want to make sure you're implementing discipline consistently, and you want to make sure you consider all relevant factors and talk to your HR or outside consultants. Once an issue has been discovered, again, like I said, you want to promptly implement any discipline and monitor for improvement. We don't just issue the discipline and then move on. You have to monitor for improvement, especially where there's significant behavioral issues and or performance issues. You don't just issue the discipline and then move on. Maintaining records, any documentation related to progressive discipline should be kept in a locked file. Obviously, now everybody does things electronically. So obviously, if it's electronic, you're going to keep the security measures on that. These are the steps of progressive discipline generally. Just a note, I always, in handbooks, try to tell people or try to draft when I'm doing the drafting, reserve the right to skip any of these steps. You don't have to do every single step of progressive discipline. These are just the basic ones that everyone's aware of. You may have other items. These aren't the only ones. Maybe you're going to have an employee do training. I've had situations where employees have had to issue apologies, but these are sort of the basic steps of any progressive discipline. One thing I wanted to mention is when you're considering disciplining physicians, if they're not your employee, if they just have privileges at your facility, you're going to need to look at your bylaws. And although HR will be involved in investigating and assisting, If a physician has privileges and the bylaws are going to govern any discipline, that's not going to be done through HR. And you want to make sure you're aware of that and that your bylaws are up to date. You want to make sure any contractual provisions cover any for-cause terminations for behavioral or other HR related issues. I had a situation where a client had a contract where the only for-cause termination was for unethical or immoral behavior. You need to have your for-cause for, professional misconduct, failure to follow policies, or any sort of catch-all of anything that's inconsistent with the policies or goals of the organization. So you want to make sure you have those in your contractual provisions. You want to consider potential reporting obligations when you're dealing with a physician. If they only have privileges, you're going to be dealing with the data bank and your state reporting. But if someone's an employee, you may not have federal obligation to report if they don't separately have privileges and they're just an employee. Again, I'm talking about physicians. But you also want to understand that New York and New Jersey and other states you have an obligation to report if you take an employment action for professional misconduct or impairment, or several of the things that you'd have to report for privileging action. So just be cognizant when you're taking action against a physician of any sort of reporting obligations. And again, that's only for facilities that are reporting entities. One other thing we get a lot of questions about, and I know we're running out of time, so I'll do this briefly, and I'm happy to answer any questions if anybody has any later on. Reasonable accommodations. We have seen a big uptick, not only in reasonable accommodations since the pandemic for health-related issues and requests to work from home due to health-related issues, but what we've seen a lot of is complaints that the employer didn't engage in the interactive process. So just a couple of pointers: keep information confidential and separate when you're dealing with a request for an accommodation. Don't opine when someone hands you a request. You have to follow the steps and consider the options. Don't just grant or deny one on the spot. Definition of disability under the ADA is a little more narrow. Your state laws are going to be a little more broad, and even being regarded as having an impairment protects someone under these laws. Failure to make a reasonable accommodation. Really, a reasonable accommodation is anything that's not an undue burden on the employer, and it's a fairly high burden to meet. The courts will look at cost, financial ability, and whether an accommodation will allow the employee to do their job. One sort of misnomer is additional time off, or time off may be considered a reasonable accommodation, at which point they won't be doing their job, but it may allow them to do their job in some short period in the future. Don't delay when you get a request for accommodation. Delay itself may lead to a claim. We've seen successful plaintiffs in those types of claims, so you want to deal with this expeditiously. The interactive process that I was talking about, again, you want to talk to the employee, find out what their limitations are. If the request they make is something that you're willing to grant and you can grant it, and you follow your process and you grant it and it's approved, that's fine. But if there's any sort of question of what the limitations are or whether you can grant the request, you need to have this interactive discussion to identify the limitations and what potential accommodations could exist. It is not up to the employee. If there are several accommodations that can be identified, it's not up to the employee which one you choose. That is up to the employer. Modifying a job to remove some functions, or changing schedules, or allowing work from home. These are all things that may be considered reasonable accommodations. I do just want to mention, I know a lot of times we may not realize this, but reassigning someone to another job may be a reasonable accommodation. I had a case where, someone couldn't come back to work after their FMLA leave, and the employer said, we don't grant any more time, and a litigation ensued, and that person could have done a desk job. There were jobs available, and they could have been reassigned, and there was a successful claim on, failure to accommodate and failure to engage in the interactive process. And just, it's not only for current employees. If a prospective employee asks for an accommodation, that's something you have to consider too. So it's not only current employees, it's also if it will help somebody gain access to a position. And I think we're out of time here, but I'll say this again. This is another thing you want to document all those efforts. You need to document every step of the way, the interactive process, and the granting or denying of a reasonable accommodation. I thank you all for spending this 30 minutes with me. And again, I'm happy to answer any questions later on.